Go ahead.
Hi, everyone. My name is Laura Hungerford. I'm a professor of veterinary public health and epidemiology and head of the Department of Population Health Sciences and the Master of Public Health program at the Virginia Maryland College of Veterinary Medicine at Virginia Tech. Thanks for joining us for this session. We have so much information flooding us about COVID-19. We're really grateful that our university panelists have taken time to be here today specifically to answer our questions. We've already received more than 100 questions, and so we've consolidated them into several topics for this hour. We're still accepting questions though during the webinar, and we hope to get as many additional ones as possible. So please feel free to submit them. This live question and answer session is also being recorded and will be immediately available in the same video player on the same webpage where you accessed it originally. So on that note, let's go to the experts. We're talking with XJ Ming, a University Distinguished Professor of Molecular Virology, Charlotte Baker, a Data and Decisions Area Assistant Professor of Epidemiology, Scott Geller, an Alumni Distinguished Professor of Psychology, and Sudipta Sarangi, a Professor of Economics and Head of the Department of Economics. Thank you all for all you are doing to use your expertise to help during the pandemic and for taking time today to join us and answer some questions. We've asked each of our experts to start off with a quick introduction as they answer the first question in their area of expertise. So Dr. Ming, can you start us off by answering the question of why these new human viral infections seem to be constantly emerging, coming mainly from animals?
Sure, Laura, and good afternoon, everyone. Indeed, year after year, there are seemingly endless emerging human infections. And one very important fact some people may not know is that the majority of the emerging human viral disease are actually zoonotic, meaning that they came from animals. So if you look at the recent emerging human viral infections, for example, the SARS in 2002, the MERS in 2012, the swine flu in 2009, the bird flu, Ebola more recently, and now the COVID-19. So all these are actually animal viruses that they jump species to infect the humans. Some of the human activities actually are to blame for this emergence of many human viral infections. Some of the activities such as deforestation, intensive farming practice, backyard farming, and wild animal poaching and bushmeat. All these activities bring the animal virus closer to human and therefore leading to new human viral infections. So I know the main focus right now should be on the COVID-19, but after we win this battle against this pandemic, I really hope that we as a society will take a long and deep look at the root of the problem for all these emerging human infections and do something about it. And there are a very large number of so-called animal viruses, essentially in every single animal species. And many of these animal viruses have long been neglected and ignored simply because they are animal viruses. Just to give you a quick example, about 20 new viruses were discovered from pigs. This is just one animal species in the past 30 years. And we know very little about many of these pig viruses. And you never know, some of them one day might just jump species and infect humans. Another example, the bat from which this novel coronavirus is believed to have originated from. Believe it or not, there are more than 200 viruses associated with the bat species. Many of them are zoonotic. So in order to prevent future emerging human viral disease, we really need to address these root of problems in the future. We need to devote resources to study these animal viruses and to effectively control or eliminate these animal viruses in their own host before they jump species infecting us.
Thank you for summarizing for that and reminding us how completely connected we are within our world between humans and animals and the environment around us. Next, Dr. Baker, we hear a lot in the news about global, national, and statewide spread. But what's the impact of the virus on our vulnerable populations, especially those in our local area of Central Appalachia?
Sure. So one thing that we have to remember is that we already have populations that we call them vulnerable populations, but it really means people who are lower socioeconomic status, who have limited access to healthcare, limited transportation, pregnant women, prisoners. There's lots of different groups, in particular here in our state, we have a lot of agricultural workers. So we also have a lot of undocumented workers, not only in agriculture, but in other fields. And so what this means is that the health disparities related to all of our populations are going to be greatly magnified. We really need to be concerned that people who have limited access to transportation are going to have even less access to transportation. So getting to the grocery store is going to be an issue, but they may not have a place at home where they can store more than a week or so of food. And so we really need to be concerned about that. Food banks are going to need a lot more donations to make sure that the populations they normally take care of will be able to have food in times like this. As the rest of us are buying up things like beans and rice at the grocery store, we also need to remember that we have a lot of cultural needs where people, that's the main staple in their food on a daily basis. And when they can't access that, it really changes up what they can eat. And it might be a less nutritious meal that they can have. We have access to healthcare issues. We have a lot of chronic conditions here in Central Appalachia, like diabetes, like heart disease, and those populations are really at risk for COVID-19. But even on a daily basis, they need regular access to care. And as more doctors' offices are closing their doors or taking limited patients, it means that these populations are having to reschedule when they already may have transportation issues or other issues getting there. So we really need to be concerned about how does this impact them and what it is that we can do on a daily basis to help out a little bit more. I love that the Montgomery County Schools, for example, has been using the school buses to take food to children who otherwise need it. That's a really great solution.
Thank you. So Dr. Geller, as we talk about all of these different ways that we're affected in both rural communities and elsewhere, what are the psychological effects of this coronavirus? The good, the bad, the short term, and the long term?
Do you have an hour? There's so much to say. Let me start by saying we are experiencing distress, not stress. In fact, I want to get back to stress. Stress means I got a lot to do and I'm in control. Distress means the perception of lack of control. And that's what we're dealing with. And furthermore, we're working to avoid failure. That's not a pleasant mindset. When I ask my students, how many in class are here to avoid failure? Many, too many raise their hand. And I said, well, I'm glad you're here, but you probably told people it's a requirement. I have to go to class, not I get to go to class. And that's where we are right now. I have to do this. I don't have the perception of choice. And that's debilitating. I mean, distress is debilitating. So, and by the way, it can be long-term. Even when this is over, this mindset can continue. So quickly, what are we going to do about this? And is there an opportunity to move forward, to improve our mindset? Well, can we turn this around and pay attention to the amount of caring that's going on? Can we see that there's people really actively caring for others? And can we maybe accept that mindset instead of win-lose? Can we get to win-win? Can we teach our kids, for example, that it's about win-win, it's about working together? And when your child sees somebody filling up their shopping cart with toilet paper, might you teach them, say, you see that that's not the way it should be. Again, the message today is we're all in this together. We need to teach that. And one more thing, I think we need to develop a mindset of success seeking. I'm working to gain something. So what can we say to ourselves and to others about what we can gain psychologically by this experience?
Thank you, Dr. Geller, for focusing on what we can learn in this situation and how we can improve the way we look at the world, as opposed to looking at it from the dire side the news seems to tell us. Following on those recommendations, Dr. Sarangi, as an economist, how do you view pandemics?
Good afternoon, everybody, and thank you, Laura. So first, we have had a long history of pandemics. I mean, Daniel Defoe already wrote about this in the 1780s. Albert Camus wrote about it in the 30s. And so in recent history, probably this is the most significant pandemic that we all know about. And the main thing to keep in mind as an economist is that in a pandemic, the pathogen is spread by humans to other humans. Therefore, till we can find a cure, the key thing is the only solution we have is how we behave to protect ourselves and protect each other. So as Dr. Geller pointed out, we are all in this together. So main thing an economist likes to say is that, when people make decisions, they think about the cost and benefits of decisions. Okay, when you have a pandemic, think about a flu shot. What happens when you take a flu shot? You protect yourself because you took the flu shot. But now you cannot transmit the flu to others. You usually don't take that benefit of the fact that you will not transmit the flu to others into account. Okay? So when we alter our behavior in ways that we protect ourselves and use it as a means to protect our near and dear ones and other people, something economists call an externality, then we take the real benefits of our behavior into account. And so that's at this point, I think the only thing we can do is alter our behavior, study our behavior. And once we do that, we can understand how the pandemic will spread and what its impact on economic activity will be. And its impact on economic activity will be, as Charlotte pointed out, there is differential impact. Different populations will suffer the impact different. Those who have more resources will probably be affected less. Those with fewer resources will be affected more. And so that's how it will play out in terms of its impact on economic activity.
Thank you all for starting us off with those different viewpoints that give us this fuller picture of how we should be looking and thinking about this pandemic. So just for all of you tuning in, as a reminder, this live webinar is being recorded and will be immediately available. You'll be able to see it and share it with others, and that we're still accepting questions. So please submit them if they come up during this discussion. So now turning to another question, something you can all contribute to help us understand is, when can we expect this all to be over? And what effects will it have in the end and during the process on our well-being and economy? So Dr. Baker, first, what do the curves that we keep seeing mean? And what is the delay between transmission happening and the curve changing? And then based on that, should we be canceling summer plans such as family reunions that are scheduled to take place maybe in July?
I think that's a really great question. I think one thing to understand is we see the curves everywhere, as Laura just mentioned, and we're talking about flattening the curve. So one thing we use in epidemiology is an epidemic curve, and that's pretty much what you're seeing on television or in the print. So when we talk about the curve, it's the number of cases over a period of time. That's simply all it is. And it is really tall. When the curve is really tall, it means we have a lot of cases at once. We have quite a few cases, and it's just pressing on our system. We are then overwhelmed in hospitals. We're overwhelmed in other types of clinical care. And we really don't have the resources to take care of that many people at one time. So when we talk about flattening the curve, part of it is, yes, we do ultimately want to make sure that no one is getting COVID-19. But we also want to make sure that the number of resources we have in our clinical facilities, whether that is in the emergency rooms, in the general hospital, in the ICUs, or any other type of clinical care, that amount of resources we have don't get overwhelmed. And so if we can slow the spread, so we want to have fewer cases at a time, even though it may mean that we lengthen the amount of time that COVID-19 hangs around. It means that we are able to then better treat the people who do show up to emergency services or who do have it and are positive, or who are asymptomatic and maybe spreading it to other people. We're slowing that down so we can better take care of everyone and have better outcomes for everyone. So think about your summer plans, and I know I've got nephews and who are graduating college and high school, and we had a family reunion this summer. it may be on the best side to really kind of sit down and think about, will that actually be feasible based on one, we know that we're kind of stuck in the house right now. Not really stuck in the house, but you're staying 6 feet to 10 feet away from other people. That social distancing part, which really is physical distancing. It's not social. We want you to be social, be and talk to everyone. But the physical distancing really is one thing that everyone can do to help us flatten that curve. It means that you're not coming close enough in contact with other people to spread the condition. And so that means that we can flatten that curve, we can spread it out a little bit. And it does mean that we're unfortunately going to be inside for a little while longer. End of July, we're not really sure. We're not sure when this is perhaps going to end. Our peak in Virginia is currently supposed to be sometime in the middle of May, middle to end of May. So it could be that we're maybe back outside in July or August. I'm a sports fan myself. I see it all over the news every day. The league's going to start back up on time. I'm doubting that's going to happen, but then again, this is life and this is a virus and this is a pandemic. So we're not sure. It may be a good time to say, let's try to make that family reunion virtual.
Thank you. So as part of how this pattern goes over time, we know that people will get sick. Hopefully most of them will recover. One of the questions we have is, for Dr. Meng, are recovered patients immune? And how will this affect potential for resurgence of COVID-19 and additional waves of disease? And is there anything that will prevent this virus from coming back and recurring next year?
Sure. It is generally believed that individual recovery from the COVID-19 should protect from reinfection, at least in the short terms. Now, fortunately, currently, we just do not know how long the immunity acquired from this natural infection will last. I know there are reports of a patient recover from COVID-19 and will test positive again. It is really unclear what happened in those patients. It could be a lot of reasons. Maybe false negative testing before hospital discharge, or maybe the virus has prolonged shedding in tissues that we don't know yet. So there's just a lot of unknowns right now. And as for the resurgence or additional wave of disease, it is quite possible that we have to live with this virus for the foreseeable futures, unless we can quickly develop effective vaccines. The virus transmission probably is going to slow down during the summer and then come back with the second wave sometime in November and December, just like the flu. So in order to prevent for recurring next year, we have to establish the herd immunity. Unfortunately, it will be difficult to do that without the vaccines. And if you look at the basic reproduction number of this virus, the significant proportion of the population will have to be infected in order to achieve herd immunity. So definitely we need to develop an effective vaccine and quick. The problem with that is that vaccine development is a very lengthy process. Typically it takes at least 7 to 10 years to develop a vaccine. That is, if you're lucky. There are multiple stages we have to go through during the vaccine development process. The exploratory stage, which we have to conduct basic lab research and discover the protective antigens. This step alone typically take about 2 to 4 years. So fortunately, in the case of COVID-19, though, we can skip this step because based on the knowledge of related viruses such as SARS and MERS, we already know the protective vaccine antigen, which is the spike protein. So that definitely saves us a lot of time. And then there's the preclinical stage, which we have used animal to prove the efficacy and the safety of the vaccine. Now, follow that, there will be 3 phases of clinical trial. Phase 1 was small number of volunteers to test the safety. Now, phase 2 was a large group of volunteers to further test the safety and immunogenicity, also to figure out the vaccine dosage and the immunization schedule. And finally, the phase 3, which is the randomized double-blind trial to compare the vaccine with the placebo. So it's a really lengthy process to develop vaccines. So I think if we're going to prevent the virus from reoccurring next year and in the future, the vaccine has to be quickly developed.
Thank you. So Dr. Geller, we heard from Dr. Baker and Dr. Meng, both things we know, but then a lot of things we don't know and a lot of uncertainty about how this will play out. How do you help kids and high school students and college students and each other go through this in the face of all this uncertainty?
Wow. I wish I had a magic bullet, you know. Yes, uncertainty is troublesome. And I have one suggestion. Psychologists and many people out there know about Maslow's hierarchy of needs, right? Abraham Maslow, a humanist, many years ago said that we satisfy our physiological needs first, and then our safety needs. That's where we are for many people. We're stuck with concern about our safety, but then we go up that ladder and we get to social needs. Again, we're separated from that social support. And psychologists know that social support is necessary for life satisfaction, for healing. But let's climb the ladder a little higher. And then we get to self-esteem, feeling good about ourselves. And many people think the top of that ladder is self-actualization. And that's, even in the introductory psychology textbooks, they're behind because it's not self-actualization. And the reason I'm going through this, because this is something we could teach each other and teach our children. Because the top of the ladder, as Maslow said in his last book, published in 1971, and we haven't caught up to this, he said, the best you can be is not about self. All those things is about self. The top of the ladder is self-transcendence, going beyond yourself for somebody else. How about that for a teaching moment? Teaching people that we're all in this together and we have to look out for each other. But here's my point. If you reach out and help somebody, that feeds those lower levels of the hierarchy. So even though we might not feel safe and secure, we can still get right to the top by actively caring, by going beyond ourselves for somebody else. And don't we need to teach our children that? What if we could have this teaching moment where we get society and our culture to realize that it's not win-lose. It's not nice guys finish last, got to blow your own horn. The squeaky wheel gets the grease. It's about actively caring for each other, not just caring, but doing something about it. And we're seeing it on TV, we're seeing talk about it. So let's teach our children the value of the top of Maslow's hierarchy.
That's great, thank you. And I think the ability to share all of those things that are going on, that good news and the amazing ways people are helping each other is such a powerful focus at this time. So Dr. Sarangi, we've talked about all the ways that we can reach out, and it's essential that we save as many lives as possible and focus on that. But at the same time, we can't afford as a country to have our economic system collapse. So how do we balance these two forces?
So I'm going to start with a very simple analogy. The easiest way to think about it is, because there probably are many engineers listening, this is a peak load management problem. Okay, so if there's a spike for the demand for power and the grid does not produce enough, there's going to be a power failure. At this point, what we are trying to prevent by doing a lockdown or asking people to stay at home and not interacting is basically manage the amount of power we are generating. If the overload is too much, basically on the medical system, then we're going to be in trouble. Okay? So what we want to do is make sure that we can keep ourselves under lockdown so that we can manage the demand for power. How many days? What is the optimal number? I don't think I can provide an exact answer to that. In fact, no one can. Regards saving lives, well, the Hippocratic Oath, the doctors will always tell you, tells them to protect lives. But guess what? Given the shortage of material, people are already having to make decisions. Doctors are doing triage. They're making crucial decisions about who should be put on life support systems and who should not. So this is just being caused by the shortage of resources in the system, and this is not going away. And indeed, it is true that we can't keep the economy locked down forever, because while the impact on differential sections of the economy is going to be different, those at the bottom are going to be hurt more. And if we keep things locked down for a longer period, there's going to be greater mental health issues. There's going to be greater issues caused by other type of health problems. So yes, we will have to make a decision sooner or later. And besides, as herd immunity develops, the returns from staying locked down start decreasing. Okay, so at some point, yes, I can't tell you when, but I will say that yeah, we won't stay in lockdown mode forever. It's not worth it.
Thank you. And so as a follow-up to that, you've been talking about what's happening in the lockdown, and we know that there's numerous stories about companies and other agencies that are deferring payments. What will be the impact of this, say, when the crisis is over, especially on students?
So deferring payments is exactly as the word says, deferring payments. It does not say eliminating payments, right? So in a sense, those payments will have to be made. So this is where probably the stimulus package is going to come in. So I think the longer the shutdown continues, the harder it will be to meet those payments. And, in one way, what we have to see is how soon we can get back, how much we can stagger these deferred payments so that it does not affect other things vis-a-vis students. Well, there are going to be issues about student loans. There are going to be issues about students looking for jobs so that they can start paying these things back. There's going to be issues about, what is happening to their pursuing further education and so on. So the real issue, I think, for students, I will say, is that, yes, while the economy is going to suffer, there's also for every sort of sector that is collapsing, there's a new sector that's growing. So there will be a revival of the economy in terms of new sectors that will come up. So I think those who are graduating should not despair. There is going to be things to look forward to. It may not be in the sector you wanted, but it'll be somewhere else. And so.
Thank you. That gives us a way to look ahead. So for a reminder, we're still accepting questions, but you can also find information about this topic area on the Virginia Tech website. And we're, I think, about to take a quick look at that. So you'll see it's a place you can navigate to for questions where the university is helping. There we go. So please come here and you'll see there are a number of resources that are available for our community, for our alumni, and for all of those that may have questions and want to know information here. Thank you. All right, so we've all learned about social distancing, or as I think the point was well made, physical distancing while maintaining social connections, which are really important. So Dr. Baker, we know what this means, but does this really just mean staying home? What about people who are essential and need to go to work? And can we go back to usual activities now that CDC has told us we should wear cloth masks?
So it's the people who have to go to work, we currently wouldn't be in the situation that we're in right now, where we're able to go to the grocery store, we're able to get packages delivered, all those different things, if people weren't going to work. And I was really excited when Dr. Saranga and Dr. Geller were mentioning is actively caring for other people. And so the rest of us, doing our best to be physically distanced from other people and not being out in public as much as possible, that does help protect the people who are at the grocery stores, who are really having to go to work so, one, they can pay their bills, and two, so the rest of us can survive. But yet, you can go outdoors. There's nothing saying you cannot go outside. So please go outside, take walks, do that kind of thing. The biggest concern is we have lots of beautiful parks and beautiful trails and all kinds of really cool things here in Virginia in our general area. But if you notice that there's a bunch of other cars at that place, don't go. Find a different place that's a little bit more off the beaten path, or it's a place that you may not have tried before. You have to go a little bit further out to find it. But part of what happens when everyone wants to go to the same park, we're not physically distancing from each other. And that means that even though you're outside, you're having a great time, you're still too close in proximity to other people. But yeah, it's perfect bike routing weather right now. So get out on the trail. Huckleberry's been really full. So also try not to be really close to other people if you're out there. Um, yeah, go outside, go sit on the porch, do other things that you could do. Wearing a mask does not protect you in the way that hopefully some of you I think have been thinking of it. It's just an extra layer of protection against you breathing out really on other people. And so that mask that you're making, that you can say, well, I'm gonna go out to the grocery store with this, or I'm gonna go out to the park with this, it's not foolproof. It's not an N95 mask, which we've basically reserved for our medical population. So it's really only to kind of help you as a stopgap to get from one to the other. But yes, if you have to go out, do wear a mask. If you're mountain biking, it may not be the greatest. You may not be able to breathe. But kind of work on that. But go outside, stay home as much as you can. And as much as you can means limiting your outside time in terms of grocery shopping or other errands to about 1 day a week, or one day about every 10 days, if possible. If we're talking about those vulnerable populations again, they may not be able to wait a whole week. So you have to remember that if you're wearing a mask, you're going out in public, you're putting people who don't have those options at risk. So remember, it's a privilege to be able to stay home, but there's people who don't have that privilege. So enjoy the outdoors and just think about caring for each other while you're out there.
Can I add one more thing to that? It's not I have to go to work, it's I get to go to work. I mean, let's change our mindset, let's throw in the word choice. I choose to do this. We have some people not following the rules. I mean, they're gathering in groups longer than they should. They're not maintaining the distance that they're supposed to. And that's because they're resisting control. We humans do not like to be controlled, and top-down control. So sometimes, B.F. Skinner called it counter control. Others have called it psychological reactions. But my point is, what if you say, just change how you talk? You know what? Some of us, we don't get to work because our job is not available, but others get to go to work and help others and contribute to this issue that we have, contributing to alleviating the issue. So anyway, our language can make a big difference. We choose to do this, and thus we feel more in control, and that's better for our psychological health.
Good point.
Great points. And I think that translates as well to the wearing of masks, right? We're wearing cloth masks not to protect ourselves, but to protect other people. It's something we're doing to help other people. And when we look at it as that kind of opportunity and a way that we're doing our part to help control the epidemic, it's different than thinking about I have to wear a mask or I'm wearing the mask just to protect myself. So it's really something that makes us a part of the solution, as opposed to something, as Dr. Geller was saying, that we think we have to do.
And it's also setting an example, isn't it? It's we want this to become a descriptive norm as well as injunctive, meaning it's something we're all doing. And so we have observational learning. Children are learning the right and the wrong for what they see adults do. So we have to say that we're always being observed. So we need to set the right example. And I could go on and on about giving people feedback with regard to the right and the wrong things they were doing and how you give that feedback.
And I will also say this is really in the spirit of ut prosim. This is what we should be doing for others.
That's great. That's great. And thank you all for that. So Dr. Geller, let's follow up. We talk about social distancing, and what about people who live alone? Should they be allowed to visit a partner who lives separately, one family member? And what's the line between doing your part to slow the spread and potentially harming one's mental and emotional health, especially if it leads to really decreased or no human contact?
Well, pick up the telephone, send an email. You've seen shots where people have visited their senior citizens and through the window, and they're showing thumbs up, and in other words, you can communicate without the physical connection. And that's what we need to learn to do. We need to learn to verbalize, communicate in a positive way even though we're not touching that person. And we can do that. We can do that. And you know what we're learning? We're learning to appreciate people more. This situation, being alone, and we're getting to realize, wow, I miss people. I mean, I miss, I'm essentially an introvert, and even us introverts can learn to appreciate the need for other people. But again, I don't think it has to be physical contact. It's a telephone call.
Great suggestion. So we've talked about practicing social distancing and staying apart from other people. But Dr. Meng, if we do this for an extended amount of time, how is that going to affect our immune system when we can be around others again? Will we be more susceptible to colds and other diseases than we were before? Will we have to build up our immune systems all over again?
It's a very good question, Laura. It's very difficult to answer because we just don't know much about this at all. We do know, however, that research has shown that prolonged isolation is associated with a variety of disease, such as high blood pressures, chronic inflammation, or weakened immune system. But will we be more susceptible to the common cold and other germs when we get around each other again? I hope not, but we just don't know. We don't have any evidence one way or the other right now.
Thank you. So again, back to that uncertainty, but hopefully it will teach us a lot and we'll be able to make good decisions based on what we do know and expand from there. So Dr. Sarangi, it seems like, as Dr. Geller mentioned, in some places, people are still gathering. They're going to stores in large numbers. Why is it so hard for people to practice social distancing?
Well, Dr. Geller pointed out some things himself. Other ways to think about it is, one way we make decisions is to find other situations where we have done something similar in the past. You can use, for example, the word procedural rationality for this. So we try to identify situations where we have behaved in this manner in the past, but this is a pandemic that we have never experienced before. Nobody in our lifetimes has experienced anything like this. So when we are asked to do something like this, that's one reason why we don't follow. Second, a lot of young people think, well, this is not going to happen to me, right? Because they read the news. It turns out that young people are not so susceptible. So they feel it's not going to happen to me, and therefore I can flout this disease. Of course, they seem to forget that we are all in this together. We are only as good as the weakest link in some ways, right? So if we want to spread the propagation of this, we all have to participate together. What could be some other reasons that people don't seem to follow this? Well, there are economic needs. If we follow some people can't follow social distancing because they have to find a way to participate in economic activity because they need it to survive. You can also think of other reasons. What could be other reasons for why people don't participate? I think for now, I will go with those three.
Can I just add to what Dr. Sarangi just said? I've worked in industry for over 40 years to try to get people to wear personal protective equipment, to try to do the right thing to keep themselves safe. And very often we have this macho attitude, as was just said, it's not going to happen to me. And now we're into this individualistic perspective. It's all about me. And what we need to teach is no, it's about all of us, as was just said, we're all in this together. So maybe this is a moment to teach the value of interdependency. Instead of independent, we're interdependent on each other. So maybe it won't happen to this young individual, but they are setting an example, the wrong example for others.
And I think one thing to also consider is younger people, particularly college-age students, are asymptomatic. And so when you think about people who are asymptomatic, it means they don't have symptoms, but they do have COVID-19. And that's been one thing that we've been challenged with this particular pandemic, is we're not sure how many people are actually asymptomatic. And that's another reason for the physical distancing. But you could feel fine. We saw that with one of the NBA players who said he felt great enough to play a game, and he actually had COVID-19. We've seen that with some additional people. And so one thing is to really say, even if you feel fine, really just help take care of each other, really do live the prosum, and help take care of other people. I mean, this is, as Dr. Geller said, this is a great time to show younger kids, or even, retrain us adults in how to do things better and how to really take care of each other.
In fact, if I might add in, this is one reason why testing matters a lot, because if somebody finds out that they are positive, that helps them isolate themselves, because they realize now I can spread it to my near and dear ones. I can affect my family, right? So that's one reason why places that have done a lot of testing have been very successful. And then I want to also add that really interdependence is important. Community-based solutions are important. And in fact, at some point, right now, all countries are dealing with this problem on their own front. But really, to address a pandemic of this scale, at some point, there will have to be global solutions as well. Countries will have to get together and think about how to address this problem. Right now, everybody wants to deal with their death tolls. So that's why everybody's insular. But at some point, we all have to get together and figure out how we want to deal with this from spreading all over the world, especially to prevent the second and third wave and so on.
And we can learn from other countries, can't we? Because some other countries are more collectivistic or interdependent than we are. I mean, Japan, the nail that rises above the board invites a hammering down. They're more believing in systems thinking, looking at the bigger picture. And let's face it, we've been raised to do it ourselves, to be individualistic. And so again, I agree, this is an opportunity to get us all on the same page of we're in this together and we can help each other. We can reach the top of Maslow's hierarchy of self-transcendence.
Thanks. And as keeps being mentioned, I think at Virginia Tech and in our community, we're particularly well positioned to that, because Ut Prosum is a model that this is one of the few places I've been, people know their university motto and really do live by it and embody it. So if you're just turning in, my name is Laura Hungerford. I'm a professor of veterinary public health and epidemiology and head of the Department of Population Health Sciences and the Master of Public Health program at the Virginia Maryland College of Veterinary Medicine. We're answering your questions about COVID-19 with XJ Meng, a University Distinguished Professor of Molecular Virology, Charlotte Baker, a Data and Decisions Area and Assistant Professor of Epidemiology, Scott Geller, an Alumni Distinguished Professor of Psychology, and Sudipta Sarangi, a Professor of Economics and Head of the Department of Economics. So let's take some specific questions about the virus and how it affects us. Someone posed, if I haven't left my house in several days and I've properly wiped down all packages that have been brought in, so do I still need to be washing my hands and wiping doorknobs and counters and remotes constantly? My hands are dry as bones, and thinking that I need to sterilize everything daily, even when I don't go outside, is making me very anxious. So first, Dr. Meng, how long does the virus live in the air and on surfaces?
Yeah, sure. This virus is very unique in many different ways, and definitely we have to change the virology textbook in the futures. And we tell our students right now, the envelope virus is easier to inactivate, and coronavirus is the envelope virus. But it has been reported that this virus can actually survive on surface for a few hours or up to several days. This really depends on the type of surface, the temperature, or the humidity in the environment. There's one particular study that is published in the New England Journal of Medicine, one of the premier journal, that show that the virus actually can survive in aerosol for up to 3 hours. And it can survive on the cardboard surface for 4 hours, and 24 hours on the cardboard, and up to 2 to 3 days on the plastic or stainless steel. So this is a very, very unique compared to other envelope viruses. Now there are EPA-approved disinfectant, surface disinfectant that are effective against this virus, such as those 70% ethanol, the hydrogen peroxide, or some of the quaternary ammonia, and they have all been shown to be effective to inactivate the virus.
Thank you. That gives us some positive disinfection steps. And Dr. Baker, carrying on from that, you mentioned wearing masks as we go out as a way to flatten the curve. What's the best and quickest way to disinfect those masks between uses?
wash them in the washing machine. So most people I saw, we do have a really neat Virginia Tech video of how to take an old t-shirt, hopefully not one of your nice new hokey t-shirts, and turn it into a mask. I've been using a buff head covering as a mask. So different people have different ones. A lot of them are able to be washed in just regular not dishwashing, laundry detergent, and then dried, and then they're good to go again. If you're touching the outside of it with your hands, you want to make sure that you clean your hands after you've touched it, because there's stuff on the outside of it. But in terms of those masks and then coming back at home and the things you have at your house, most things, like even though it lives on cardboard for up to 24 hours, it's really low chance to actually get the virus, let's say from a box that you just got from Amazon. Some people are leaving it outside for a little while. Some people are leaving it in the garage. Really, if you take a pair of gloves, you take a t-shirt or something, and then cut the box open, take out what's in the box, and then just throw the box away. You're reducing your chance of touching it or getting it that way. Even though the chance was already extremely low, you have a higher chance of getting it from another person. If we're talking about transmitting it outside of your house, say you're wearing the mask to the pharmacy or somewhere else, it's really for you to protect from other people. We're also in allergy season. So if the rest of you are like me, your face is currently hurting, and that doesn't mean you have COVID, it means you have seasonal allergies. And so you're sneezing and coughing and doing things like that. So it's also just another way so you're not having to touch those germs and give that stuff to other people. So you just want to kind of keep an eye on what it is in terms of cleaning your hands. If you've been in your house by yourself for a long time, you don't have to just continuously keep washing your hands. One thing I keep in my house is I keep lotion next to every place where I'm washing my hands. And I make sure my hands are dry, and then I put lotion on and make sure that my hands stay moisturized that way.
So thank you. One of the other questions that's come up related to how we might transmit or catch the disease is the idea of pets and animals. And so some people have been very concerned about this, but despite over 1 million human cases, there have been very few animals affected. Now, you may have heard in the news about some high-dose experimental studies where they were able to infect cats, and also some recent cases that were detected in tigers and lions in the Bronx Zoo. So we do know that cats can catch the virus from us, but this looks to be incredibly rare. But we do know that the virus, as we've been talking about all hour, can spread very easily from human to human. So if you're sick, treat your pets like any other family member and restrict contact. If your pet is sick, contact your veterinarian. But if you're well, enjoy your pet and enjoy your other family members, be outside, take advantage of opportunities to get exercise, and do your usual kind of socializing within your family group and outside. So, Dr. Geller, we've talked about a lot of these other kinds of information, and especially addressing this person's concern about going outside. How can we help ourselves and others to make decisions that weigh the risks and benefits appropriately, and will help us feel safe as we go about our lives?
Wow, I mean, I'm not sure that's a psychological question. I mean, what do the physicians say? What is safe? Again, a point I always think about is pleasure is contrast. And we are living in a deprived situation right now. So just going outside now for a walk is very rewarding. And so, but again, I don't know what to say about what the rules should be. I mean, we keep our distance. It seems to me we can go outside and we can keep that distance, that social distance. And so we just have to be cognizant of that and follow that basic rule. And again, we're all in this together, and we need to talk about people and say, look, by the way, practice doesn't make perfect, only with feedback. So sometimes people need feedback. They might be unconsciously incompetent. They might not realize that they're too close. So again, we need to help each other keep that physical distance, but you can still socialize. And you can still even show body language and smile and be friendly and to keep that distance. And even wear a mask. I mean, for me, it seems this is this is over the top, but it really isn't. And again, it's setting an example for others. Maybe you're not symptomatic and you feel fine, but we want everybody to be protecting themselves on behalf of other people.
And I think a follow-up to that would be some of us do live in highly dense living situations. And so we may be in an apartment building where, we have neighbors and things like that that are really close to us. And so you can still practice social distancing even in those situations. It's a great chance to get to know your neighbors and get to know their names because we have tended to move to a society where we don't necessarily do that very often. But I've really had the pleasure the last few days of seeing my neighbors stand on the opposite side of the street of each other and have a conversation. And so you can still talk to each other. You can still move in the same places, even if you live in a densely populated area.
So I'm just going to throw something out there for those who have better technology abilities than I have. Maybe someone should develop an app that helps people social distance. The 4 main steps of social distancing every day. You check off the ones you were able to do. And then we can keep track of how well the Virginia Tech community or Blacksburg is doing in terms of social distancing. Now, this is beyond me, but maybe somebody else wants to do it.
That's a great suggestion. And think of all the innovative and clever ways our students, as they're working from distance and learning all these new techniques, can help us to connect better and share that kind of information. So let's follow up with that with Dr. Sundri, with thinking about when this does end. How do you expect the economy to change when the stay-at-home orders are no longer in effect and people can start going about again?
Okay, so that would require a crystal ball. But I think for sure, there's going to be what we call pent-up demand, right? So everyone's been stuck at home for a very long time. I can imagine people will want to get haircuts. I can imagine people will want to get their nails done. I can imagine people will want to go to restaurants. I can also imagine that those who have already experienced this and survive will be braver than those who have not, because there's still that residual doubt, unless we have a cure, that if I go out, maybe I'm a little more vulnerable, right? And as I already mentioned earlier, I still think that places like malls and so on will still continue to suffer. I mean, big malls in the US were already on a decline. People have moved to online. And this kind of hiatus is going to shift behavioral patterns. So that's for sure. I think there's going to be a bigger push for online. But as I also mentioned earlier, this is going to spawn a whole new set of industries, right? So to just take, to take an example, this is now creating creative use of, people are trying to figure out how to make masks in a creative way, right? So this was not a need for the economy 3 weeks back. We were not worried about how to make face masks. So obviously, what is going to happen when we come out of this, there's going to be an initial surge of economic activity. There will still be fear amongst people about how much to mingle, but we've been locked inside for so, memories tend to be weak. We forget these things quickly. So people will go out, they will mingle, but all these models predict that there's going to be second round and possibly even a third round. So I think we're going to see ups and downs of economic activity.
Can I throw in one quick point? Gratuity is such an important concept. Let's thank these people who are maintaining that physical distance, or let's thank those healthcare workers who are going every day on the front line. Gratuity, saying a sincere thank you, helps both the recipient and it helps you as the giver of gratuity. Psychologists in the field of positive psychology have shown that your sense of life satisfaction increases when you show and receive gratuity.
I agree. And I think there's a lot of forgotten heroes kind of in this. Some people may not use the word hero, but there's a lot of people who are working really kind of behind the scenes to make sure that we are flattening that curve, who are having to go to work every day. The people at the health department, the people in the Medical Reserve Corps across the state who are volunteering their time to come and help make sure that they're answering those phone lines when people have questions, the grocery store workers who are there, the people who are making less than or right at minimum wage to be at work, the people who are having to watch their children or getting to watch their children and things like that. they're all working together. So we're together. And I think it's really great for us to always remember to say,
Dr. Baker, that's great point. And that can put us in the mindset of success seeking over failure avoiding, right? We're in this state of avoiding failure. I don't want to get sick and blah, blah, but all of a sudden we show gratuity and we show kindness and we actively care. All of a sudden we can be success seekers within this pandemic.
And I want to add one more thing to this. What it really is telling us is that when this pandemic is over, we now understand who is really frontline worker. These people who we now suddenly realize are at the front line were always at the front line. It's just now that we really get to see that. So what I really want to tell everybody is when this is over, we should continue to keep thanking these people for what they do for us. If we have just realized it, we should keep doing it.
And related to that is we've taken it for granted, haven't we? We've taken for granted that these people do what they do. And this has given us an opportunity to really appreciate them. And I'm back to gratuity. Yeah, let's hope this does continue when the physical disease is over.
And so I think that's the perfect note to wrap up on, the idea that we're better recognizing opportunities to be grateful, how important they are to the people that we express that gratitude to, but also to each of us. That recognition changes the way we look at the world and makes it a better place. And so with that, we're out of time. I'd encourage you all to keep thinking on this positive note of what new things are going to come out of this, what we're learning, all the amazing new developments that this is pushing and speeding up, and keep that balanced with the concerns that we have and the other kinds of news that we're hearing. And so thank you all for watching and for submitting such great questions. Thank you to our panelists for taking the time away from the really important things that you're doing to help respond to the pandemic and to communicate to others, and setting aside this time to talk to us and to be a part of this. We have gotten a number of questions that we didn't address today that were related to operations at Virginia Tech. So I wanted to share that the Virginia Tech president, Tim Sands, will host a virtual town hall for the whole university community on Thursday, April 9th, this coming Thursday at 11 a.m. And you can find more information about that or watch it actually from the university's homepage. So thank you to all our panelists. We invite you to follow up with questions because we couldn't get to them all. There will be information on how to do that and how to reach other experts at Virginia Tech. So please stay tuned for that. And remember that the latest information from Virginia Tech related to COVID-19 and the coronavirus will be at vt.edu/COVID-19. And you can also find it just by going to vt.edu, our university homepage. So thank you again to all of you for your questions, your engagement, and hopefully the attitude you'll take away today after hearing from our great panel of experts. Thanks.